Good morning, everyone. Very excited to be here today for this afternoon to have Judith Grimaldi with us, as well as Yeung Mee Kim Jun. They're going to be talking with us today about Medicaid and the updates that are going on, along with estate planning and the new home care rules that are going on. So with further ado, I'm going to let them introduce themselves to you all, and we're going to get started with this presentation. And thank you, both of you, today for being here to speak with everyone and share your knowledge with us.
Thank you. I'll begin, okay, Yeung? So I'm Judy Grimaldi, and we both are with the law firm of Grimaldi and Yeung. We're located in New York City, so some of our our approach will be focused on New York Medicaid. Those of you who may be aware that Medicaid, which is our topic today, and home care rules specifically, there's a blend of federal law and state law. And as you may know, federal law is will underpin all of the Medicaid programs. So there's a universality across the whole country about how Medicaid operates. And then New York State and every locality gets to manage their own, you can really go to the next slide, manage their own program in their state according to their state rules. So therefore, you may see changes state by state. We'll try to be aware of those for those of you who are not New Yorkers, but it will be predominantly focused on New York. So Medicaid in New York, it's a partnership. 50 cents of every dollar that's spent on a Medicaid recipient, 50 cents comes from Washington, and another 50 cents comes from the locality, New York State or New York City or whatever county you're in. And so you might see a variation county by county. In general, all Medicaid programs must provide for the health care of the aged, the blind, the disabled, and the low-income people, children, and pregnant women. Those are the areas that Medicaid covers, or the populations that Medicaid covers. We will be specifically talking about the aged, blind, and disabled population, which sometimes people call it SSI related. So it's people who are low income, who have no other health insurance and need this either as their primary or supplementing their long-term care needs. So anyone over 65 could apply for Medicaid if they meet the income and eligibility guidelines, resource guidelines, which Yeung will go over. Some of the programs that are most important to the over 65 population are the community long-term care services, which include home health care, home aides, personal care aides, assisted living program in certain settings, consumer-directed Medicaid, other services like transportation, physical therapy, durable medical equipment, and of course, nursing home. But today we're focusing on home care. Next slide. Next slide, please. Yeung, it's yours.
Okay. Hi. So thank you for having us again. My name is Yeung Mee Kim Jun. I'm an attorney with Grimaldi and Yeung law firm. So here is the 2020 Medicaid levels. There are two different financial eligibility criteria for Medicaid. One is for home care services, which is what we're focusing on today, which is often referred to as community Medicaid. And the other is for nursing home care, which is referred to as institutional Medicaid. So first, for an individual to receive community-based long-term care services, which Judy just mentioned earlier for home care, the applicant has to meet both income and resource criteria. So as you can see in the chart here, resources are your assets, what the things you own, your bank account, your brokerage accounts, and your house, and et cetera. As of 2020 for community Medicaid, for your income, your monthly income as a single person household cannot exceed $875 per month. If you are in a two-person household, you're allowed to keep $1,200.
I think she's frozen, so it's $1,284. And you see that little star, that's a $20 disregard. So it's really almost $1,300. As soon as she unfreezes, you'll see her talking. There are special rules for non-applying spouses. So many of our clients come to us and if they're a couple and they say, well, if our combined income is more, do we both have to go down to $1,284? And the answer is no. The applying spouse can apply on their own based on an individual rate, and the non-applying spouse could have up to $3,216 in income and up to between $38,000 and up to $128,000 in, $74,000 up to $128,000 in resources. I don't know what happened to Yeung, but I'll.
Am I back?
You're back. You're back.
I'm sorry. I apologize for that. Oh boy.
Since you froze a bit, I think it was a spotty internet. So
I apologize for that.
So income is quite low. And most people will find that, how could I ever live in New York City or New York State or in any city pretty much and have an income of only $875 a month, even with the wonderful $20 disregard. It's impossible. So we'll talk a little bit about getting around that, but just so you understand, that's the baseline and it's poverty level. The resources, some people say, well, what about resources? You mean I could have $15,000 in my bank account, or the actual term is it must be $15,000 in every single asset you own combined. So it's as if they took a snapshot of you today. How much could you have access to today? And it would be $15,000. So it would include your checking account, your savings account, the cash value of your life insurance, those little savings bonds that rubber banded in the middle in your underwear drawer. All of those assets are pooled together to make the 15. And it's a flat fee. So it's 50, if they took a snapshot at any day of the week or any month of the year, 15 is still only what you have. I'll let you take back over. Yeah.
So, okay, so you left it off as single person's resource limits, correct?
We did a little bit about spouse. We did a little bit about spouse, that there are special rules for spouses who are not applying. And it defies logic in my mind. How could, the spouse who's not applying, who isn't in need, they could have more money than the individual, but it's a bit illogical, but a spouse could have almost over $3,000 in income a month. And the applying spouse could have their $894, and the combined balance, though, of both the whole household is $3,216. Anything above that must be contributed. Do you want to talk about spend down and the spend down theory in our state for income, Yeung?
So spend down theory for income. So income, if you have in excess of income of what Medicaid allows. So if you have more than $875 as a single person, you have two choices. You could either give back the excess amount back to Medicaid to pay for your medical service, or you could actually put your excess income into what's called a pooled income trust, where you could access that money for your everyday spending. So that is what New York State allows you to do for your excess income.
They don't have that. So just if someone's from out of state, so New York gives you a road. They say pick a fork in the road. You can either contribute your excess income to cost of care, or you can put it in a pooled trust. Other states have what's called income cap states, which say, here's the top level of income. You go above that, we have to say goodbye. New York never says you have too much income, go away. They said, just give us your excess income. The cap in states like New Jersey, like Florida, those are income cap states. They have an income of about $1,500 a month, which is much more generous than the $895 that we have, but it's still a cap. Whereas New York has no cap. It says either contribute or join a pooled trust. Now, New Jersey will have some kind of pooled trust as well. It's just they have a higher cap. That's all. Okay. Next slide.
So, Next slide.
Let's go to the next slide. Yeah.
Okay, so as I discussed earlier, there are two different rules for community Medicaid versus institutional Medicaid. For someone that is applying for nursing home Medicaid, the income level is significantly different. For a single person going into a nursing home needing Medicaid, your monthly income that you're allowed to keep is only about $50. So everything else gets contributed to the care of your services in the nursing home. So everything other than $50 has to be paid to the nursing home to pay for your care there. If you are a married couple and have a spouse that's going to be living in the community, the community spouse is allowed to keep $3,216 as same as the rules for community Medicaid. Resource levels remain the same as the community Medicaid. If you're a single person applying for Medicaid, whether in a nursing home or community, you can keep up to $15,750. And if you're a married couple, you could keep up to $128,000 as your asset.
Yeung, can you explain, are there any deductions against income other than the $50? So if I'm in a nursing home, can I keep any money for anything else?
So if you're paying for any insurance premiums, if you're paying for any your medical costs, you could deduct those from that monthly income and still keep it so that you could still pay for those expenses.
So if I'm in a nursing home and I want to keep my Medicare and I want to keep my AARP policy that I pay $350 a month, they'll let me keep $50 plus the $350 to pay that premium?
Yes, and you'll pay that insurance fee with that money.
Great. Oh,
okay. So we can move on to the next slide. And this is, we're going to now talk about the changes in community Medicaid. So the nursing home Medicaid remains the same in New York State, but the New York State budget of 2020 that was passed had some significant changes to the community Medicaid rules. So the rules for up until last month, New York State applicants who applied for community services, meaning if you needed home care services and needed to apply for Medicaid, there was no look back period for community Medicaid. So if you needed home care services, you used to be able to transfer your assets to a trust or a family member or whoever you transferred it to and still qualify for Medicaid the following month. However, that is no longer the case. Now, New York State Medicaid requires 30-month look-back period for all applicants for community Medicaid, meaning all applicants need to submit 30 months worth of financial statements to show that no prohibited transfer of assets were made in that 30-month period. Now, if there were any transfer of assets made either by the applicant or the applicant's spouse, there will be a penalty period imposed based on the amount transferred. A penalty period refers to a period that you will not be eligible for Medicaid. Initially, Medicaid said that this rule will impact all applications submitted on or after January 1st of 2021, and that any transfers made on or after October 1st of 2020, which was just a week ago, will be reviewed. However, it is not yet set in stone, and it keeps changing, so we're not quite sure when the effective date will be yet, and we're keeping a close eye on this effective date. And Judy is going to discuss this a little more in detail in a later slide.
Could I speak a little bit about spousal rights in our state? New York is unusual. Florida has a little bit of it, and Massachusetts toys with it as well. But we have a privilege, and I'll call it a privilege, called spousal refusal. What does that mean? It means that if a couple comes to us for a consultation and says, I want my husband to apply for Medicaid because he's now been determined to have Alzheimer's, and I'm projecting out that he may be in need of home care and maybe, God bless him, even nursing home in the future. So what can we do to protect ourselves? My answer would be we could transfer all the assets to the well spouse, and I'll put well in quotes because we never know, none of us have a crystal ball, but the well spouse. And if and in his applying for Medicaid now, he's poor because he gave everything to his wife. He has maybe he has his IRA and he has his income and the share in the joint ownership of the house. Mrs. Wells' spouse could say, I refuse to contribute my income and resources to my husband's care. I'll still take care of him. I'll still do all the things I do, but no money for him, please. And that's called a spousal refusal. It's a one-page, very simple document. At that juncture, Medicaid will say to that spouse, we can't attach any of your income and resource. It's no longer available to him because you've refused. And he can receive Medicaid right away. Even the 30 months look back wouldn't apply to that transfer. Transfers between husband and wife are exempt. And if she takes the money and refuses to contribute it towards his care, he can get immediate Medicaid. There is a little bit of Damocles sword hanging over her head that could come down at her. And what in that terms, what I mean is that Medicaid could evaluate that she has the means to contribute and she's just refusing, and they could sue her not under Medicaid law, because Medicaid law says this is okay, but under domestic relations law, which is the marital law that binds us, you know, the vow we make, rich or poor, sickness and in health. Well, that's domestic relations law, and they could say to her, you know, this is sickness and in health, this is richer or poorer, you have to contribute. And if she's found by a court to have the means to do so, she would have to contribute. But she's already gotten Medicaid for many months. She's already got the services at Medicaid's much lower rate than the private payer rate. So it's a good deal all around. So I do encourage people to sign spousal refusals, even though there's this potential for recovery, because the recovery is much less than the actual upfront cost.
Thank you, Judy.
Spousal refusal is alive and well in New York, and it's available. And so people who are married have this special privilege. Next slide.
Next slide. So some of you may already know this. Currently, the look back period only applied to nursing home Medicaid applications. In New York, nursing home Medicaid rule requires that all applications submitted for nursing home Medicaid provide all financial records of applicant and his or her spouse during the 5-year period prior to the date of application. So they're going to review 5 years worth of statements. Medicaid reviews these records for, again, prohibited transfers made during this period. All transfers made for less than fair market value are prohibited transfers. This means these are referring to outright gifts to your children, transfer to a trust, anything that you didn't pay for exchange a good for is called a transfer that's not allowed by Medicaid. There are some transfers that Medicaid does allow, which Ms. Grimaldi will discuss later. Next.
So do you want to, okay. Some people wonder, how do they figure out this penalty period? It's not as complicated, but not as complicated as you might think. So what they say is, what would a month in a nursing home cost? And they've come up with a number. It's $12,844. Was that what the number was? If we go back one slide, you'll see. So they say, okay, an average cost of nursing home care is $12,000. I'm going to use that because my brain's a little lazy with all those extra numbers.
Right.
So $12,000 is the number. And let's say I gave away $48,000 to my son because he said, I need a down payment on my house, Mom. You promised to help me. So I gave him $48,000. Medicaid would say, if I divide the $12,000, which is what you would have spent on a nursing home, into the 48, you could have paid for 4 months of nursing home care. So that's what I'm going to punish you for. So the penalty would be 4 months for a $48,000 transfer. And they're going to apply that same calculation, that same formula to nursing home and home care cases going forward. So that's how they figure out the penalty period. It's not that mysterious. The average cost of nursing home care divided to how much you gave away to come up with how much nursing care you could have bought, how many months of nursing care, and that's the penalty period. Okay.
So yeah, the significant change that we are focusing on is the community Medicaid change, which now has a look back period of 30 months. And as I discussed earlier, and as Judy discussed just now, The penalty period will be calculated according to the same regional rate that the nursing home medications are calculated upon. And now I'm going to give it back to Judy to discuss further about the planning portion of how you can plan ahead for you to be able to receive services for home care and community-based long-term care services.
Thank you, Yeung. So home care, just in case you weren't sure, what is this home care? It's the services that when you apply, the managed long-term care programs will provide for you. So it's home health, it's private duty nursing, it's personal care services, it's assisted living services. And I say this with caution because Medicaid only covers assisted living in certain facilities. So if you say, oh, they'll pay for my Sunrise room or my Bristol room or my Atria room, no, they won't, because they don't accept Medicaid. But there are some adult homes and some facilities that are assisted living that they'll accept. And then the most important one that people are concerned about, will it cover my CDPAP worker? And CDPAP is a program, stands for Consumer Directed Personal Assistance Program. And that's when you could hire your daughter to be your home attendant, or the lady down the block that you know so well, or your brother-in-law's mother-in-law. You can find your own worker, and as long as they pass a physical, are willing to work for the minimum wage that Medicaid pays, and or have legal papers to work, they can be paid by Medicaid while you organize their services as almost like an independent worker. Okay, next slide. So when will this, just to review, the rule of transfer of asset goes into effect October 1st. There's 2 programs that it won't apply to. There's actually 3. Anyone who's on a TBI waiver, that's traumatic brain injury waiver, anyone who receives services from Office of Persons with Developmental Disabilities, which is people with OMRDD designations, developmental disability, any of the mental health kind of services are exempt, and hospice services are exempt. So when an application goes in for long-term care after October 1st, they're going to ask you for 2.5 years of bank statements to show whether you did prohibitive transfers or not. This word prohibitive transfer sometimes is mysterious. What is, and Yeung did it, explained a bit, so I'll give a little bit more definition just to drive it home. The prohibitive transfer is anything that you get value for. So if I just gave my son that down payment that I talked about, that I'm not going to get anything out of that. So that's a prohibitive transfer. But if I repaired my own bathroom and I did a renovation, and I spent even much more money than $48,000, that I'm getting value for, so that's not a transfer. You can spend money, you can use money, there are exempt things. You can buy a funeral, you could buy a new car, you could pay off your credit card debt. Those expenditures are fine because you got something for it. It's just when you give it away to a family member or you're not going to get anything value for it, that's prohibitive. There is a little exemption that let's say someone has said to me, I've always paid for my granddaughter's camp. I've done it for the last 10 years and I want to continue to do it. And it shows up that I put a $2,000 check out every summer for her camp. And I didn't know, I wasn't doing it for Medicaid purposes. You can explain certain transactions if indeed it's a pattern of giving that is established, or that, your onset of illness is very sudden. There is a pushback by Medicaid who says, well, you're 85 and you've been very frail, and what were you expecting, that you wouldn't need these levels of services? But we have been able to argue when there's a pattern of giving that is not related to Medicaid at all. So prohibitive transfers and the look back have some ability to be negotiated away in some ways. But as Yeung described, there may be a possible delay in the effectiveness. There's a lot of rules in applying Medicaid. As I said, it's a federal and state program. So we have federal law to deal with and state law to deal with. And merging those laws sometimes makes for complication. I think it keeps Yeung and I in business. But what I'll say is when they during COVID and also during the implementation of the Affordable Care Act, they were afraid the states were going to pull back services so they wouldn't have to pay for them. So they made a part of the law to say that whatever programs you had in place before the law changed, you have to maintain that effort. You can't pull back on it. And that's called the maintenance of effort rule. In the COVID rules, they said, if you're going to take the money from the CARES Act, that all the states and all of us got some, you have to maintain the services you had before. You can't take the money and then do budget cuts. So because of that maintenance of the effort rule, the state is not as free to change rules in the middle of the game. So this delay may be extended through the end of January. It may even be extended through the end of April. So please, if you're going to be applying for home care services during this volatile period in New York State, please be aware that you may have an ability to defend against the implementation of the transfer of asset. So rely on your counselors who are helping you, rely on elder law attorneys like ourselves to advise you, because there may be some opportunities to just stretch the rule out a little bit. Next slide. Many people worry about, what about my house? That's most of us, that's the most valuable asset we own. So let me just review that. The first thing they're going to look at is, how is your house titled? Is it joint with that refusing spouse? Is it joint with someone else? When a husband and wife own the house, it's very often able to be transferred to the other. But if you own it independently, that house is up for consideration. Now, Medicaid has a rule that says if you live in the home, it's exempt. We all know that they're not going to take the roof off from the top of your head. They don't want us to make a whole generation of homeless elders because of their healthcare costs. So the house is not considered an asset as long as it's under the Medicaid equity value limitation. And right now the value limitation is $830 or $38, but it's a little bit over $800,000, and that's a bit challenging for some of us who live in some of the gentrifying neighborhoods that, our house wasn't worth that before, now it is. There are so many $1 million homes in Brooklyn, and we look at our homes, we look around the walls and say, this house is worth $1 million. I'd never pay $1 million for this house, but that's what they're worth now. So, so you do have to be aware that you may be bouncing over the equity limitation. So houses have to be examined carefully, but at the moment, we believe that the house, of course, is not counted in a Medicaid assessment of eligibility. But what if you wanted to get it out of your name because it's over the equity value, or you're worried about, what if I go to a nursing home and I can't live in the home? The house is exempt because your 2 feet are in the living room. If your 2 feet are in the nursing home living room, will the house continue to be exempt? So it is a worry. Next slide, please. Next slide, please. Okay, so will the transfer, so if you came to me and you said, I think I'm going to need home care, it's past October 1st, I want to get the house out of my name, will it impact my eligibility going forward? And this is based on considered opinions of many elder law attorneys, but the state of New York has not given its a seal of approval on this opinion. So it's still a little bit up for grabs, but where the question is, will the house, which was exempt, be exempt if I transfer? Will it be an exempt transfer? Although the policy hasn't been set yet, we believe it will be exempt, because if you're transferring something that is exempt for Medicaid purposes and you give it away, then it should have no impact on your Medicaid. And we base it on New York social service law and also on federal law. Just you to be aware that that equity value, I misspoke, it's $893,000. So if you have a house worth more than that, even if you're living in it, it could be attachable by Medicaid for the additional exemption, the amount over the equity value over that exemption amount. If your spouse is living in it, if a disabled or minor child is living in it, there's no equity limit and it will remain exempt. What if you went into the nursing home? Who could I transfer to? Who could I give the house to? Again, your spouse is exempt if you give it to your spouse. It's exempt if you give it to a disabled child, a caregiver child. Let me remind you who a caregiver child is. It's a child who lives in the house for more than 2 years and has provided some level of care, very loose level of care. I take the garbage out for my mother every Monday. That could be the level of care. They don't scrutinize that very well, but living in the home, they do scrutinize, and you have to show proof of that. And there's a fourth person or entity that you could give it to, and that's a sibling who lives in the house and has an equity interest. Very often the house was grandma's house, and two sisters, one sister lived upstairs and one sister lived downstairs with grandma. Grandma died, and now the two sisters own half and half. If the downstairs sister gets sick, she could transfer to the upstairs sister, and it would be exempt transfer. The downstairs sister's children may be a little grumpy about that because they're not going to get that inheritance, but that's another way to exempt the house. Since the house is an exempt resource, we believe the transfer should be exempt because you're giving away something Medicaid didn't count, so the transfer should be exempt as well. That's up to be challenged. So I'm going to advise my clients to do that, but I'm preparing them that it might require a hearing or an appeal to prove that. So it may be decided by the courts in the future. Next slide, please. Many people worry, will this change of rule affect me? I've been on Medicaid for years, and there may have been some transfers done, and if they look back, will they find them, or my recertification, do I have to worry about that? We've been told that there is a grandfathering in of anyone who's on existing Medicaid will not be re-examined, their finances will be not re-examined, and even on recertification. They'll treat this just as they do an institutionalized person. A nursing home, we have experience with nursing home persons. If they make a non-exempt transfer, it won't be counted. And as a general rule, there will be no retroactivity. So those of you who made your transfers before October 1st, we believe you'll be safe from any penalty period imposed. Next slide. So what triggers a penalty period? And that's a challenge because, we want to know, when does this 2.5 years start? Because a person wants to know, when will I be financially eligible? Judy, I'm going to come in and talk to you and you're going to give me advice, but I want to know a definite date that it's safe for me to apply for Medicaid. So in order to there are two things that you have to do. You have to apply and be financially eligible. So you have to meet those criteria that was on the chart that Yeung showed you. And the second is that it has to be a demonstrated need for long-term care. What is that? That you have a functional need. So it's not just you're poor, but you're poor and in need of home care. So how are we going to prove that? We believe that a physician's form needs to be submitted to establish eligibility. Right now, New York has a form called an M11Q. It's a medical request for home care, and the form number is M11Q. That's where it comes from. We believe that form needs to be submitted as well. And there are regulations coming down that were supposed to start on October 1st, but there's been another bureaucratic glitch. But they say that you have to have at least 2 ADLs that require physical maneuvering. So that's transferring out of your bed, helping toileting, dressing, bathing. Those are the kinds of ADLs that you need to have 2 of them. And if you have a cognitive impairment, then you only need 1 ADL. We're not sure when this specific implementation of this 2 ADL requirement will start. We believe it will start in January. So that there was never that specific scrutiny. You still had to prove that you needed help, and that determines your hours of care. But now it's a definite barrier if you don't have 2 ADLs. And that we worry about sometimes, especially in the Alzheimer's community. Sometimes people are very physically fit, but their cognitive impairment is what makes it more difficult. So they can feed themselves. They can actually wash if you cue them along and guide them along. They can dress themselves if you say, here's the sweater, put it on, and they'll put it on, they'll follow instructions, especially at the early stages. But yet, if you weren't there to cue them, it wouldn't happen. So that cognitive impairment will make sometimes this establishing of ADLs a little bit more challenging. And so the caregivers who are listening today, you have to break down the tasks that your loved one needs into very specific functions, so that it's clear that there's a need for physical maneuvering. And those of us who want to keep our loved ones engaged, we say, no, they can still dress themselves. They can still do this. And it's true, they can. But you have to remember that you're giving them a whole lot of guidance along the way. So when they're evaluating ADLs, you have to be very specific and careful to make sure that it's understood that without the guidance and the triggering, it might not happen at all. They would just sit there. They wouldn't dress. They wouldn't feed unless you were triggering them. And that's kind of an invisible disability that sometimes is not so clear to the assessors. So you have to learn to make it clear. Next slide. So there are some other transfers that are exempt that you should know about. One of them is an annuity. Some people say, I have this pile of money that I saved, and that's my nest egg, that's my security blanket. I don't want to give it away to my child. I don't want to put it in. I want it to be available. You could take that pile of money and buy an annuity and convert the money into, or the resource into, an income stream. There are rules about it. They have to be actuarially sound. They have to be for your sole benefit. But you can convert money into an annuity, and the annuity is now no longer an asset, but an income stream, and it makes it exempt. You can purchase a life estate. If you say, I'm going to move into my daughter's house because it's really much more comfortable and I feel safer there. You could take that pile of money and buy a life estate in your daughter's house. You're going to move in anyway. And so you can say, instead of just giving her a gift, would be a prohibitive transfer, you're going to purchase a life estate in her home to allow you to live there. And that would be an exempt transfer. We elder attorneys work on promissory notes. So you can say, I'm giving my daughter this same pile of money, but I'm going to give it on a condition that she has to pay me back, so that you're not giving it away. You have an expectation of a return, so that we would develop a promissory note. It's like a mortgage. It's payable back to you. And that note would be structured so that it wouldn't interfere with the Medicaid income and eligibility guidelines. And of course, we said you can transfer your assets to a spouse, a disabled child, a blind child, or a trust for the benefit of a child. And it has to be for their sole benefit. It's only to be used for them. And those are often called special needs trust. You may have heard of that, or SNTs. So you can establish a spouse, transfer to a spouse, a disabled child, a blind child, or a trust for the sole benefit of this disabled child, or a trust for the benefit of any individual over 65 who's eligible and who is disabled. So for example, if I really loved my next door neighbor who's disabled, I could set up a trust for that benefit. It does not need to be a family member. It could be any disabled person, as long as it's for their sole benefit. So people have considered these exempt transfers. Next slide, please. Which transfers will apply? Which exempt transfers will apply? Any transfer, and this is really referring to the prohibited transfer. Any transfer that was for fair market value or for other consideration is exempt. Any transfers exclusively that were transferred for another purpose, but not to apply for Medicaid, like I promised to pay the tuition, or I've been doing, the $15,000 gift every year. I didn't know I was going to be on Medicaid. And you can spend down your assets. You could say, I always was going to fix the house up and I never did because I was too frugal. Well, if it was going to be giving it to a nursing home or fixing up the house, I'm going to fix up the house. So you can use it for any kind of asset any kind of improvement or expenditure you were planning to do that you hadn't done. We talked about credit cards, funeral plans. These are the things that you might choose to do rather than have to go through a penalty period. Next slide. Pool trust. We talked a little bit about pool trust. I don't know if I want to give myself a breath and let Yeung explain pool trust, and then I'll explain why it's an exempt transfer. Would you like to do that? Explain the use of pool trust?
Sure. I think I briefly mentioned it earlier, but pool trusts are used for any excess income that you may have. If you're a single person and have more than $875 coming in per month as your income, you can put the rest of your income into what's called a pooled income trust. Now, pooled income trust is a community trust that are established by nonprofit organizations. So it's a shared trust in the community where people that are in the similar situation pool their money into this trust that are run by this nonprofit organization, and it can be used.
Yes. So we believe
Is it working?
Yes, we believe
Can
that
you hear
even
me?
these.
Okay.
Yes, we can hear you. Were you finished? No, we can't hear.
I think I'm having some connection issues. I apologize for this.
So I'll talk it over then. So, so a pool trust can be used under these new transfer rules. Right now, people over any age, if they're in the community-based program, will use a pool trust to shelter the extra income they have over the $895. And so we're saying that the transfer of asset rules, here the word asset, doesn't apply to income. So it's not going to affect pool trusts. People who are in a nursing home cannot use pool trusts because it's a different set of rules. But beneficiaries of community-based Medicaid that are not in a nursing home, that are still in the community, can continue to use pool trusts. And we do not believe that it is considered a transfer of an asset. It's a transfer of an income. New York State hasn't agreed with us. We've been negotiating with New York State for the interpretation of the pool trust. And the current position of New York State is, yes, the transfer into the pool trust of income is exempt. But if you allow the money to sit in that pool trust unspent, at the end of 30 days, what the balance that's left in could be considered a resource. And remember, Yeung taught us that our cap on resources is $15,000. So if the amount in the pool trust added to the amount you have in your own checking account at home or your own rubber banded savings bonds in your drawer, if you add them all together and it raises over $15,000, you could be violating the resource rule. So we're cautioning people under this new rule, if they're putting money into a pool trust, do not allow the balance to rise up. Use it. It's supposed to be a revolving fund, just like your checking account. Money goes in at the beginning of the month because it's income, and then you use it to pay your bills. So don't let that pool trust balance rise up. We're still negotiating. We still think that New York State Medicaid has it wrong, but we're not going to put our clients at risk. So if we can keep the pool trust balances down, we believe you'll be safe. If it rises up a little bit, as long as you have some expense. Sometimes people say, I'd let it rise because I only pay my real estate taxes quarterly. So I need to have a bulk sitting in there to pay my real estate taxes, which is $10,000 a year, let's say. And if you're in Long Island, it's $35,000 a year. The real estate taxes are really high. So we understand the building up where they say, my heating bill is higher in the winter than in the summer, so I let it build up for the higher heating bill. You're going to have to figure out some different arrangement than let it sit there. Maybe you're going to have to pay your real estate taxes all at once, or do it on a small quarterly income. Now, instead of quarterly, maybe you'll pay it monthly. And I'm sure the city of New York will take your money monthly rather than quarterly. And so you may have to do a different kind of budgeting of how you pay your bills, not allowing it to accumulate inside the pool trust. Next slide, please. And we're almost out of time. So I think we can skip this. I think we covered this well. And we did this as well. Okay. Gift and loans. So this was a strategy that we wanted to just introduce to you, that we believe that if you have, it's past October 1st, you have a pile of money that we keep talking about, and you say, I need Medicaid tomorrow. My husband or I just had a stroke and I can't, my left side is paralyzed, I need home care tomorrow. But I have this, and I don't want to lose this pile of money. Yes, you told me I could just spend it down, and when I'm down to $15,000, then I'll apply, but then I won't have enough money for my real estate tax next month, or whatever my extras I keep this reserve for. So we believe that there are some solutions. What we would do in that case is maybe say, you can't keep the whole pile, ma'am, but you might be able to keep half. And we'd put it into a kind of annuity that would pay out an income every month that would keep you, that you could then put in a pool trust. So this is, and the time we have allotted, this process is probably a little bit more complicated than we can go through. And there's a lot more answers that we need to get from Medicaid to make this work. But what we wanted to tell you basically is that they're individually, when you sit down with a counselor, an elder law attorney, a financial advisor, there may be some solutions within annuities and loans that could reduce the amount that you have to pay down, and you could maybe keep some reserve. So we're working on goals to enable you to keep some reserve above the $15,000. $15,000 is not enough of a nest egg to make us feel safe, and we understand that. We hoped that Medicaid would understand that in the long run, if they keep you in your home, then you won't have to go to a nursing home, and in the long run, the state will save money. But that's a challenge so we hope that we'll be able to use annuities and gifts and loans to be able to start the penalty period, be able to reduce the time of the penalty period, and leave you with some portion of a nest egg for you and your family to feel more secure with. Next slide. So if some people say, is there any defense? You know, suppose I have no annuity to buy, I just want to keep my money. Is there any defense? So Medicaid does provide for an undue hardship defense, that if you were left with no money, or that maybe you gave the money away to your son and he paid for a camp and you can't get it back, because they're going to be going back 2 years. And let's say in a year from now, I become ill and I have done this helping my family all along like I always did. And then it's time for me to need Medicaid, sadly, because I don't have enough money to support what home care is turning out to be, is something like $5,000 a month. What can I do? You can claim undue hardship. The DOH promises to provide us with guidelines on undue hardship, because they know there are certain circumstances where, because they change the rules in the middle of the game, there may not be solutions. The other is there are immediate need applications. Right now, we have a program for home care that says most times it takes 60 to 90 days to get through the bureaucratic application process, assessment process, before you'll actually get a home aide walking through the door. 3 months wait for services when I just had a stroke and I'm paralyzed is intolerable. I couldn't afford 3 months worth of home care privately while the bureaucracy is working my application through. So they developed a program called Immediate Need, where they're supposed to provide you with home care with a determination of eligibility in 7 days, and new services, startup services, in 12 days. That's quite a fast turnaround. When there's this 30 months of look back now, they're going to have to examine 30 months of documentation before they can do this. Can they do that in 7 days? Probably not. So they have a form of attestation. When you do immediate need application, you can put in your application and just attest, swear, I didn't give away anything. I have no transfers of assets, and they will go forward and provide for Medicaid under that 7-day immediate need rule. What will happen on that? If you've lied on that attestation, it's going to come back to haunt you. But for those who genuinely do not, they will not be held back. So immediate need applications will still go forward as they are now, merely with the attestation and swearing that you have no. So those of you who are worried or concerned what will happen in the future if I can't get my act together, but I need services right away, the immediate need applications will continue, just to reassure you. Next slide. So we're open for questions. And how do you want to handle questions?
Yeah, so what I can do is I can see the chats and the questions going on, so I'll pose it to you both as we go through them, if that's okay.
Perfect.
Yeah. So the first question we have is it's a two-part question. They first at how are the ADLs being evaluated currently during the pandemic? And then what is an example of what type of wording should they use to document the ADLs?
Me or you, Yeung? You want this one? Oh, she's frozen. I guess I have it. So currently, they are using tech. They're not doing home visits. We've heard very little about people coming to the home. So they're using documentation like this M11Q form or a assessment form from a doctor. They've been doing Zoom calls when technology is available, and they will interview on Zoom, and they'll ask the aide or the elder to just get up and walk and show what they can and cannot do.
Mm-hmm.
So there's a lot of self-reporting. And when it's by telephone, they've been doing some by telephone, and they just, I guess, are trusting their interview abilities, but there's no visual to accompany it. The example of documentation or wording, we use a code, we call it ATT. Are you back, Yeung? Can you speak? No, she's still
Am I back? Can you see?
Yeah, you're back. So would you want to talk about
Okay.
ATT, the ambulation transfer toileting codes we use to get people to have tools to describe the need? The question was examples.
So as an example, the wording that you would use is, it depends on the need of the patient, obviously, but if your loved one needed assistance, meaning they can't do things on their own without you physically helping them, you want to specifically tell them that they need physical assistance with ambulating, which means walking. When they get up to take steps, if they need you to hold on to them, you want to specifically tell the nurse's aide that of the specific amount of help that your loved one would need to take those steps without your help. With transfers, the same thing. You want to tell them specifically how much help they would need to get themselves up from the bed or the chair and to get themselves from a sitting position to a standing position. Same thing with toileting. How much help do they need? So you want to be specific about the amount of help that you are providing if you're the one that's providing the assistance, or what you are seeing your loved ones do for themselves and what they cannot do for themselves.
With an Alzheimer patient, it's sometimes tricky because they are physically fit often. So you have to break down the tasks. So I'm going to use toothbrushing. Brushing their teeth. If I said to my cognitively impaired relative, I said, come on, let's go and brush their teeth. And if I walked away, they might not do it. They might look at the toothbrush, but I have to then say, okay, so in breaking down the tasks, you have to especially if you don't have a visual, you have to verbally describe, this is how, yes, my mother can brush her teeth, but I must get the toothbrush, I must put the toothpaste on, I must hand it to her, I must watch her, I have to remind her to do the back of her teeth, I have to remind her, I have to hand her the water to rinse her mouth, and I have to help her spit it out, I have to clean her mouth when it's over, I have to put the toothbrush back, I have to put the cap back on, I have to do all those steps, and that's how you can describe it for someone to understand that why toothbrushing could take 20 minutes because all those steps. Or think about the toileting. Yes, she knows she has to go to the bathroom, but does she remember how to get the pants down and up and not wobble? And does she use the toilet paper properly? Is she really clean? Did she get it up? Did she trip over herself? All those steps have to be broken down because when they assign services, they assign it by task, and they have a chart that says bathing takes 20 minutes, And so they say, okay, if she needs bathing dressing, okay, and they add the 20 and 20 and 20. Oh, so she only needs 2 hours to get in the morning to get herself going. And you know that it takes a whole lot more than 2 hours, because you have to cajole and explain, and maybe because they're still physically able to do things and you want them to do it. So that's what we mean by, if you could kind of break it down into every little step and make sure the nurse understands the complexity of every process.
Great. And then we have another question that one individual asked: if they miss the October deadline, or their client does, is there any extension? And if not, what would be the most expedited way to do that?
So are you saying they didn't make the money transfer, so the money's still in the elder's name, and they want to apply? I would say do them as soon as possible, because there is a lot of fuzziness about when it starts. October is in the law, but as I said, the federal law says you can't really change the rules of the game in the middle of the game. There are some people who are assessing that this law cannot be in place until April because of the changes in the maintenance of effort. So it could go anywhere from, I'm rigid, I'm saying October 1st so I know my clients are safe, but I'm going to still put some applications in with transfers that occurred maybe October 15th, and if it gets through, God bless them. If it doesn't, we'll defend. But I think we should be there's probably a pretty hard January 1. That's in the law as well. But there may even be extensions to January 23rd. There's a lot of legal rules on maneuvering, but all I can say is do it as fast as possible, and then go to an advisor and get the application in as fast as possible. They have not asked for any documentation yet, and I don't think they're going to start asking until January. So get it in fast. Just move as fast.
Our next person's asked: my husband's pension is directly deposited into my individual checking account every month, and from that I pay for his Medicare supplement plan and RX plan and other of his bills. Is this an acceptable way of using assets?
Well, you're talking about income. So of course, your income will always be payable to you if you're the owner of the income. Medicaid can never take the income. All they can do is demand that you pay the excess to them or put it in a pool trust. In applying for Medicaid, they will budget out any insurance premiums for you and your spouse. They will budget out the $894, $895, excuse me, and there are only medical expenses are budgeted against or deducted against income. The household costs, their heating bill is not. You're supposed to live on $895 a month or $3,216 for a couple. So the functionality of receiving the money into your checking is fine. The paying of your bills are fine. But when you get your Medicaid eligibility budget, they're going to establish that excess income and amount, and that's the amount that either has to go into a pool trust or be paid to them.
And we have someone who just asked, are the Medicaid protection trusts usually recommended, which you've been talking about?
We believe that an asset protection trust, first of all, it must be an irrevocable trust. The Medicaid applicant cannot serve as their own trustee. They have to have a third party or their spouse as the trustee, and that they have, once they put it into a trust, they personally have no access to the funds in the trust. There could be others who have access, like their spouse and or other relatives, but they have to relinquish control. So we believe in them, but they have to be done with an understanding that you give up control, and that starts the clock on penalty period, whether it be the 30-month or the 5-year penalty period for nursing home. So we believe in them. I'm not sure exactly what the question is asking in terms of advising. We generally, our firm rule is if your assets are less than $50,000, we sometimes say maybe the trust is too complex and the cost effectiveness is not there. But that's really an individual decision. Some people still say, I want a house certainly should go in a trust. There's some very important tax benefits that you have in putting assets in a trust rather than a direct transfer to your child. There's 5 Ds we worry about when you give a child the money directly rather than in a trust, and that's worry about the death of the individual that you gave it to. What does their will say? Because you gave the money to, I gave my money to my son. His will says everything goes to his wife. God forbid my son dies before me. Now his wife has my money. Do I trust her the same way I trust my son? Maybe not. So that's one caution. The second is they could get divorced, and now my money is in the middle of their divorce. He could become disabled just like me, and now my money's in the middle of his disability. He could have debts he didn't tell me about, like he isn't paying his student loans off, and now my money is viable for his student loans, which maybe wouldn't be so terrible. And then the last is his dishonesty. So in examining a direct transfer versus a trust, we examine those dangerous Ds, death, disability, divorce, debts, and dishonesty, and the viability and the management of a trust's costs. So we kind of balance the two. I hope I answered. You want to add anything?
No, yeah, they said thank you.
Oh, okay.
And then I'll wrap up with one more question. And this person has asked, how are the legal documents and things like that being handled, especially with elder law attorneys and the paperwork because of the pandemic going on, in terms of if it's for notaries or things like that?
Yeung's become an expert. Why don't you tell them about it?
So we're doing a lot of our work remotely, and thankfully the governor has given us an executive order allowing us to be able to notarize and witness legal documents remotely. I mean, there are sets of rules that we need to follow strictly, such as we need to see the person signing the document at the same time that they're signing it by video conference. We have to make sure that they're actually in state of New York. We have to check their IDs, and whatever documents that they did sign has to be sent back to us on the same day. So there are rules that we have to follow, but we do have a permission from the governor saying that we could do this remotely. So this is how I've been conducting our legal document signings.
Okay, great.
Executing the
they just
documents.
have real quick one follow-up. The person who asked that question had a follow-up. They're the caregiver for their person, but they're living in another state right now. Does that impact the ability for them to be on the virtual meeting and sign off on this documentation?
It will, but they could always go to their notary in their state and have their portion signed, depending on the legal document that they're executing.
So if the elder is in New York State, they can sign it, and then we can send the documents for the other person to execute in their state, in person maybe.
Okay. Well, thank you guys so much for being here today. It's such a pleasure, and I'm getting a lot of thank yous coming in for going over this and taking the time to explain it. A lot of people are also saying, I hope you're staying safe during this time. And so they have some questions. Are people able to email you at the email that's on the screen right now if they have further questions?
Yes. We,
right.
as courtesy to your organization, will accept emails and answer questions that way. Yes.
Okay, great. And so just some thank yous. This was tremendous. I learned a lot, so much. I agree so much with this. So thank you guys for being here today during this time.
One other offer, I don't know if you have this facility, but you're welcome to distribute the PowerPoint to the participants if you think if you can manage that.
Yes, definitely. So I did create, if you look on the side, there is a handout for that, and we can also re-email that out to everyone as well.
Thank you.
All right. Well, thank you guys again from ASA for being here today. This has been so educational, especially for caregivers who are working with people.
Our pleasure.
Okay. All right. Everyone have a great day.
Okay.
Thank you for having us.
Thank you.
Thank you.